Hello everyone, welcome back to Med with K. Today, from the arteries of the human body, we'll be talking about the radial artery and the ulnar artery. So let's begin. The radial artery is the main artery of the lateral aspect of the forearm. It originates from the bifurcation of the brachial artery in the cubital fossa opposite the neck of the radius. The other terminal branch is the ulnar artery. The radial artery gives several branches in three main regions. Number one is the forearm. Number two is at the wrist, and the number three is in the palm. So let's go through each group in detail. In the forearm, the radial artery gives four branches. Number one is the radial recurrent artery. So this is the radial recurrent artery. It originates just below the origin of the radial artery in the upper part of the forearm. This radial recurrent artery, it supplies the elbow joint and it also supplies three muscles. Number one is the brachioradialis muscle. Then we have the brachialis muscle. And if I hide this brachioradialis, I'll get the supinator muscle. So it also supplies the supinator muscle. Now we also have various muscular branches. Next, we have the palmar-carpal branch. It originates near the lower end of the radius, just above the wrist joint, and it mainly supplies the radiocarpal joint and the carpal bones. Now see, this is the radial artery and this is the ulnar artery. The radial artery gives a branch that is the palmar-carpal branch of the radial artery, and this ulnar artery, it gives a branch which is the palmar-carpal branch of the ulnar artery. Now this palmar-carpal branch of the radial artery and that of the ulnar artery, they anastomosize and they form the palmar-carpal arc. Then we have the superficial palmar arc. So this is basically a superficial palmar arc of the radial artery. It originates just above the wrist before the radial artery winds around the lateral aspect of the wrist. It distributes the thenar muscles and the skin of the palm and it contributes to superficial palmar arc supplying the fingers. Now coming to the branches of the radial artery at the wrist or the hand. So this radial artery, as it winds around the lateral aspect of the wrist just before entering the anatomical snuff box, it becomes the dorsal branch of the radial artery. This dorsal branch of the radial artery, it joins the dorsal carpal branch of the ulnar artery and the anterior and the posterior interosseous artery. So this is the anterior interosseous artery, this is the posterior interosseous artery to form the dorsal carpal arch. So you see, this is the dorsal branch of the radial artery, this is the dorsal carpal branch of the ulnar artery, this is the anterior interosseous artery, this is the posterior interosseous artery. Together, these four arteries, they form the dorsal carpal arc. Am I clear with this point? Now this, it supplies the carpal bones, dorsal ligaments and gives small dorsal metacarpal arteries. So you see how beautiful this is. Now coming to the branches in the palm of the radial artery. This radial artery, it gives the chief artery of the thumb, that is the princeps pollicis artery. This is the main blood supply to the thumb. Next, it gives the radialis indicis artery. So this is the radialis indicis artery. It distributes or it supplies the lateral aspect of the index finger. Next, we have the deep palmar arc. So you see, this is the deep palmar arterial arc. It joins the deep branch of the ulnar artery. So you see, this is the deep palmar branch of the ulnar artery and it joins with the deep palmar branch of the radial artery and it forms the deep palmar arterial arch. Okay. So now it gives various branches. First, we have the palmar metacarpal arteries. It is usually three in number. And then we have various perforating branches. And then we have a recurrent branch which joins the palmar carpal arch. So this is the recurrent branch of the deep palmar arch and it joins the palmar carpal branch of the radial artery or basically the palmar carpal arch. So we are done with the radial artery. Next, we move towards the ulnar artery. The ulnar artery results from the bifurcation of the brachial artery in the cubital fossa. In the forearm, the ulnar artery gives three branches, that is, the anterior ulnar recurrent artery, the posterior ulnar recurrent artery, and the common interosseous artery. It also gives various muscular branches in the forearm. Coming to the anterior ulnar recurrent artery, it originates from the ulnar artery just below the elbow and ascends in front of the medial epicondyle. It supplies pronator arteries mainly. Now coming to the posterior recurrent artery. So this posterior ulnar recurrent artery, it originates slightly below the anterior ulnar recurrent branch. It ascends behind the medial epicondyle and it supplies flexor carpi ulnaris. Then it goes and supplies the triceps brachii and also the posterior elbow capsule. Talking about common interosseous artery, it gives out two branches, that is the anterior interosseous artery and the posterior interosseous artery. The anterior interosseous artery gives out various muscular branches. It also gives the nutrient artery to radius and ulna. Then it has a branch which is known as the perforating branch. This perforating branch, it joins with the posterior interosseous artery. You see over here, this perforating branch, it joins with the posterior interosseous artery. And the anterior interosseous artery, it terminates at the end of the wrist by joining the palmar carpal arch. Talking about the posterior interosseous artery, it passes behind the radius and the ulna and it gives out a branch which is known as the interosseous recurrent artery. Now it also meets a perforating branch of the anterior interosseous artery and then it terminates as the dorsal carpal arch. Coming to branches near the wrist, it gives out a palmar carpal branch of the ulnar artery which anastomosizes with the palmar carpal branch of the radial artery and it forms the palmar carpal arch. So it distributes the wrist joint and the carpal bones. Now this ulnar artery, it also gives the dorsal carpal branch. So this dorsal carpal branch anastomosizes with the dorsal carpal branch of the ulnar artery and forms the dorsal carpal arch, which supplies the carpal bones and the dorsal wrist ligaments. The ulnar artery terminates by giving out a superficial branch of the superficial palmar arterial arch, which anastomosizes with that of the radial artery. And it also gives a deep palmar branch of the ulnar artery, which forms the deep palmar arch, which also anastomosizes with that of the radial artery. So this is it for today. In the next video, we'll be covering the anastomosis around the elbow joint. I hope you are finding my content useful and beneficial. If you have any suggestions or any doubts or a particular topic in your mind that you want me to make a video on, kindly drop in the comments. And if you like this video, please do like, share and subscribe. Till then, have a great day ahead.